Good morning, all. As we had discussed in last class about hip AVN, the conditions of hip AVN, we will continue with these conditions further. In these conditions, we will take more over on SI joint, more on back pain with condition of hip avascular necrosis. There are so many conditions. As we have seen that we have made a exclusive protocol of exercises for lower back pain and hip AVN for stage 1 and stage 2. What are the relevant factors of back exercises with the hip joint? We have to understand this thing. So first we will try to correct our gait, our walking pattern. After that we will move to our exclusive protocol of hip exercises. As we have done in last class, that all the lower limb exercises, all the exercises which is related to the pelvic area is directly or indirectly associated by our lower back. So in lower back area, we have to target on so many muscles, posture and gait. Gait is our walking pattern. So first, we will try to correct our gait, our walking pattern. It could be due to incorrect posture, it could be due to any pathology, and it could be due to any sort of associating factor which is impairing our walking pattern. So we will move with the walking pattern first, then we will move to correction of the posture. So in walking pattern, as we have seen, so many patients walk like this with hip pain, a basic limb gait. So we have to trace the muscle, we have to check the muscle in which area we have to do strengthening, in which area we have to do more work. So we have to trace that particular area. For example, I'm having a right side pain, so I'll walk like this if I'm having weakness on right side. So for this weakness, I had to correct my gait in front of mirror. In front of mirror, I can see, suppose this is the mirror, so I will try to walk in a straight way so I can correct my posture. First thing. Second thing, I can walk in a manner by which my foot don't get outwards or inward. It gets in a straight line. We can take a chalk marker road or a sticker marker on the floor by which we can move in a straight way. So for example, I'm using a yoga mat over here. So I will try to walk on this only with the rotation or clockwise or anti-clockwise. So first we will start with this. I'm walking on this in a straight way. So I can see my foot. By correction of gait, I can see my foot. So it's not going outward or inward. As you can see, as you all can see, I'm walking on a mat. So first step to correct the gait pattern or the walking pattern is walk in a single line. So I'm walking like this. As you can see, if my gait is affected, if my walking pattern is affected, so I walk like this. It could be outwards or inwards movement due to pain or due to insufficiency of the muscle. So for correction of the insufficiency of the muscle, I will walk in a straight line like this. It's in a straight line, first forward, then little bit, backward, then forward, then backward. Why I am walking on this mat? Because I have to decide a particular area of walk. If I walk on floor, then it could be divided more on left or right on both sides. So I have to walk in a straight line. You can do practice on a mat, on a sheet, on a simple parallel way or single floor tile by which you decide your area of walking for correction of walking pattern. Again, we will do this thing. I'm walking in a straight line like this. This is to correct the gait pattern. This is step 1 in a forward way, then in a backward way. Backward way, we have to take care of balance because due to backward movement, we can get impaired balance. So, this is the first step to correction of the gait. Now, we will walk on sideways direction. This is the second step of the correction of the gait. If I am having pain on right side, then I can initiate from right side or the side of the pain. We will move towards the direction of the pain side. If I'm having pain on the right side, then I'll move like this in a short step. What the main thing which we have to take care is that my foot is going in a parallel way. I will make you understand by this that I am using my right leg. After that, stabilizing of the right leg, then I am moving with the left leg. Again with the right leg, then with the left leg. It should be in a parallel way. I'm doing like this, so I cannot move this leg in a forward or in a backward direction. This have to be moved in a parallel or in an equal way of the same direction. So we have to start. We have started with the pain side. After that, we will take other side. So we'll start the pain. We'll start the pain side. 1, 2, 3, 4, 5. 5 steps I have taken on the pain side area. I'm having pain on right side. Whatever it is, it could be back pain or hip pain. We are talking for both the things in a combination. Again, 1, 2, 3, 4, 5. So it's a single round, but we have started from the pain side to correct our walking pattern. So as we have started, you may feel the difference between right and the left leg. If I'm having pain on the right side, then it could be possible to disbalance from the right side and completely balance on the left side. So we have to make sure that your balance will not get disappeared in this thing. 1, 2, 3, 4, 5. We have stabilized the base of our foot. 1, 2, 3, 4, 5. This is sideways walk to correct our gait pattern. Now, as we have started from our pain side, then we have to move on other side. We will move on other side like this. 1, 2, 3, 4, 5. They both are in a parallel way. 1, 2, 3, 4, 5. This is the second way to correct your gait pattern. If someone is having replacement in the hip joint or someone is having replacement in the knee joint, then also they can do this thing to correct their walking pattern. Until unless there is some difference between length of the leg. Now we have done second step. Now we will move to our third step, which is very important, but it is not indicated for the patients who are having any neurological disorder. So if you are having any disbalance problem or any problem which is related to your balance in the walking pattern, so don't try to do this. This is very important, but it's in a cross walk way. So in this is very important. Third step, in this, we will use our first step in a cross way. It's in a cross way. So when you will use your leg in a rotation with the cross, then you may get feel stretch over the sides of the hip muscle, which we need basically to correct our gait pattern. First is this, second is again straight. This leg will move in a straight way. We will do one by one. First, we are doing with the right leg. Then, second step, we will do with the left leg. I'm moving this leg in a straight way. That we have to understand that I'm moving this leg in a cross way and this in a straight way. I'll show you one more time. I have started with my right leg, straight, crossed, straight, crossed, straight. That's it. No backward movement or no sideways movement in this. Again, one more time. If you're having any little disbalance difficulty, then you can do with the support of any ball or with the support of stick also. So we are moving like this. We are not moving it completely or we are not giving any rotation towards the hip joint. We are just giving a balance or a stability to our sole in our lower feet for improving our walking pattern. So I'm walking like this. It's a little deviation. It can be if we will measure this angle, it's around 30 to 40 degree from the center. 30 to 40 degree from the center. It's like this, straight, this, straight, this, again straight, and this is end. Okay. So we have done with the right leg. Now we will do with the left leg. The first leg which will move is our affected leg. If I'm having pain on the right side, then I have to start all these pattern of the gait from the right side. If I'm having problem on the left side, then I have to start all the patterns, all the walking initiations from the left side. That is very important thing to remember. So as we are moving, we will move with the left leg now. This is first. It's little bit twisted, little bit 30-degree outward movement of the great toe from the center line. It should be specific because if you will move in a specific way, you will get recover slowly, and the recovery will be with the strengthening manner. First, second, third, fourth. As I can move due to my leg length, only 4 steps in this mat. Otherwise, 5 to 7 steps are normal, and we have to move at least 50 to 70 steps in a day. That's it. 50 to 70 steps in a day. Again, I'll show you which movement I have done. It's crossed movement of the walking pattern. It's little bit outwards. First, second, third, and fourth. This is the third step to correct our walking pattern due to back pain or due to hip pain. This is the cross way. Now, last and the final walking pattern of correction of the gait is broad and narrow gait. For broad gait, how we will decide the length or the width of the step? It depends on your mat. It should be 1.5 to 2 feet width at least. 1.5, 18 inches minimum width of the mat to improving your walking pattern. So next step is fourth step. Step number 4 is showing the width of the length, the width of the stride or the leg length. I'll move one way in a broad way. There is no any reverse movement in step number 2, step number 3, and step number 4. There is only reverse movement in step number 1. So this is step number 4. This is broad gait. I'm walking on the edge of the mat like this. Reverse. And next is narrow gait. Narrow gait is to walk like very short steps and near to the both feet together. This is short step gait correction. You can feel the difference of the muscular activity in these all activities, in these all exercises to correct your gait pattern. Because in these all steps, we are giving stretch to our hip muscles, to our core muscles, to our lower back muscles. So I will do one more time step number 4 to correct our gait pattern. It could be related to some sort of knee pain or ankle pain, but if you are having any severe knee pain or any ankle pain, then please don't try to do this. We will move with the broad gait first. This is the broad gait. And this is the narrow gait or short step gait. We can say that this is the short step gait. Short as much short as you can. This is the short step gait. So we have done total 4 types of patterns which will improve our walking way or walking pattern as the short gait, as the narrow gait, or the short step gait, sideways gait. Always we have to understand this thing that we will initiate our movement from the affected joint or the joint which is having more pain. If we are having pain on the both side, then we can move from any side. We can start from any side and end from any side. At least 50 to 70 steps of each movement of each exercise is mandatory to correct your gait pattern. Although this is a very standard protocol to correction your gait, if you are having any specific pathology, then you can discuss. Or if you are having any specific problem in your hip joint, it could be replacement or it could be decompression of the hip joint, then we may discuss afterwards. But if you are having any difficulty in these movement, then please don't try to these movement. Okay. Now, as we have done 4 movement, now we will do basic hip exercise. Basic hip girdle exercise with walking pattern. As we have done stage 1 exercises in last class, now we will move to stage 2 exercise for strengthening of the hip joint. For strengthening of the hip joint, we can use this roller or any pillow or any sort of rounded thing which we can hold between our legs. So we will move between our legs in thighs. What we have to see in this, that a foot is in straight position. My foot is not in deviated position, not inwards, not outwards. It's a standard or in the center position. You have to be aligned because alignment is very important to do these exercise correctly. So I have put this between my thighs. After the placement, I will compress this with a gentle pressure and hold 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. As you can see, I am doing compression of this roller between my thighs. A gentle movement you can feel over the knee joint or the inward movement of the knee joint you can see or you can feel doing this while doing this exercise. First step is this. Second step is to hold this roller between your knees. So in your knees, you may get deviated of this roller due to strength changes in both the sides. If you are having more strength on right side, then it could be like this. If you are having more strength on left side, then it could be like this. So for strengthening, for maintaining this roller between your legs, you have to be in a straight way and with a gentle pressure from the both sides. For example, if my this leg is 80% strengthened and this leg is 90% strengthened out of 100, so this leg will give more pressure on this. So I have to compromise with the strength. I have to cut my strength up to 50-50 only. So I'm giving both sides equal pressure by which this will get erect. By which this will get erect. This is very important concept of this exercise while standing, because this exercise is very important to strengthen your knee joint, strengthen your low back and glutes muscles, strengthen your hip joint muscles. So if you are doing it correctly, then it's awesome exercise by which you have to see the correct way by which you can do this exercise in a correct way. I am giving equal pressure from both of the knees like this. It's not like this or not like this. If you want to judge your muscle strength, then you can see the effect of deviation. You will press the roller and the roller will get deviated of either side. So I'm giving a gentle strength, gentle balance on the center of the roller. Then I'll hold 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. This is step second. Now in step 3, I will hold this roller in between my calf muscles. In between my calf muscles or side of the calf, inside of the calf will work for the compression. Then I'll hold this 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. This is also a centric movement or the movement which I am giving towards the center of the roller. This is very easy and very simple step to follow to correct your hip and knee joint muscle strengthen. I will do one more time. In this, you don't need to stick this upwards or near to the groin. It's between the thigh area. It's between the thigh area, away from your pubic area, and it is in the center. It's not deviated on right or left side. It is in the center because exercises are always less and specific. If you do all these exercises in a specific way, in a way which they are exactly exist, then definitely you are going to strengthen your muscle gradually. So you have to maintain in a center way with the compression. I am giving compression, I am giving pressure from the both sides. It is equal, whatever it is, but it is equal. Holding with a 10-second period. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. This is the step 1. Now I will follow the step 2. In step 2, I am holding this between my knees with the hold. I have to check the deviation. It's not deviated, it's in the center. I have to check my foot position. My foot position is same. Then I will start counting. But for that, I have to stabilize first. It's going down. It means I am giving one side extra pressure. So I have to reduce the pressure and maintain the pressure. Then I will I'll give straight pressure on the both sides. Hold for 10 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. If I'm having any mirror, then you can do in front of mirror. It is very good exercise. Now in step 3, I will hold between my calf. I'll check the alignment of the roller. I will check the alignment of the foot. It's fine. Hold it for 10 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. That's it. This is the base or abductor strengthening for the hip joint and the stabilizing exercise for the hip as well as knee joint. Now we will move to our next exercise. This is indicated for 10 seconds each exercise, at least 5 to 7 repetition at once. Means at once we have to do 5 to 7 repetition minimum. Now we will do our next exercise. This exercise we have done already. You can do one thing, that you can take a support of wall or anything which is lies your behind, by which you may not get fall down. I have taken support of the wall. I have taken support of the wall. After taking support of the wall, I am putting my right leg on this roller and moving with the full swing forward and backward, forward and backward, forward and backward. This is for your quadriceps muscle and for your hip muscles. At least 25 to 30 times in each direction. What is the important thing which we have to see in this, that I am maintaining this roller in a straight line. Again, the alignment of the exercise, the alignment of the muscle during the exercise is very important. I'm doing like this. It's in the single line 25 to 30 times. After doing my affected leg, you can take it on another leg. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 14, 15, 16, 17, 18, 19, 20. 20 from right leg and 20 times from the left leg. It is to increase proprioception or to increase the balance from your sole and from your calf muscles. As we have seen, all the types of exercises are very easy, but there are some difficult exercise also to strengthen your hip joints, including semi squats or including lunges with the weight. These all exercises are lies in stage 2 exercises. As we will move to stage 3 exercises because we have to complete the hip regime, complete the correction of the gait regime in this session. So we will move to the advanced exercise pattern also. In this pattern, we will move with the weight and without the weight or the resistance. We will start without the weight. What we will do these exercise in a way by which our hip muscle get strengthened more. So it's a sort of rehabilitation program, but in an advanced way. So we will straight and joint our hand like this. Before doing any type of squats or any type of lunges, we have to maintain our balance. If you are having any problem in maintaining our balance, then we have to correct our balance difficulties first, then we will do these exercises. So please don't do any of these exercises if you're having any difficulties in the balance due to any neurological deficit or any deficit of the lower limbs. So we will straight our hands like this. We will move right forward and little squat, then left forward and little bend like this. In this, we have to see that our legs are moving in a straight way. If you will use this mat, then you can do it perfectly. I will do it a little bit faster for you. It's a more advanced form. Why I'm doing enclose my hands? Because to maintain the balance or to maintain the deviation of the both sides, I have to do like this. We can do like this also, but this is not indicated because some ways it hamper your back muscles. So we are not doing like this because we are doing it collectively, back plus hip regime. It's a pause and do, pause and do. There is a pause. This is the first step. Now, in the second step, we can do with the weights. Now, in second steps, we can do with the weights like this. Again from back side. This is to maintain your balance because these weights is basically for maintaining your balance. This is the first step for the advanced exercise with and without weights. Now we will do squats with these weights. There are basically two types of squats. First is semi squats with broad gait. Second is full squat with narrow gait or the broad base, we can say. Now, in a broad base, we will do squat like this. This is most safest way to do this because in this exercise there is only a semi movement of knee of the back joint with the hand movement. We have to do hand movement also together to maintaining a balance, which we'll use for the proprioception training also in further classes. 1, 2, 3, 4, 5, 6, 7, 8, 9, This is a broad base gate. With this broad base support, I had done this squat. Now we will do with the narrow gate. This is broad and this is narrow. It's very simple. This is broad and this is narrow. In this narrow, we'll use 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. That was without weight. Now we will do with the weights or with the resistance. It's a broad base. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. It's a broad base. Now we will do narrow base. This is my base. I'm using my base for doing these exercises. I have narrowed my gate. I have narrowed my base. After by narrowing, I have to check the alignment, whatever it is. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. It's an equal 4-limb movement. So it will increase our balance and proprioception also. Because I'm doing movement with both of my hands, with both of my legs. And with the visible socks and the black mat, because you can see the movement of my feet or the movement of my base gate correctly. So you can do it at your home. Next is very important, and it's a sort of a difficult exercise. So if you are comfortable with this exercise, then try to do. Otherwise, it's not that much necessary, but it is very important to strengthening in an advanced way. It is cross and bending. Cross, bending. Cross, bending. Cross, bending. Cross, bending. In this exercise, we have to maintain our balance, because what happens sometimes if you will do cross and bend, then you may get fall down on either side. So it's very difficult. If you are having comfortable with these all exercises, if you are having good gait training, or if you are having complete hip muscle strength, then you can do or you can attempt these type of exercises. It's cross, squat, cross, squat, cross, 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 cross. The one thing which we have to see in this, that in this exercise, what we were doing earlier, that first is cross and second was straight. In this exercise, both the steps are going in a cross way. So cross, squat, cross, squat, cross, squat, cross, squat, cross, squat, cross, squat. This is very helpful for the knee pain, because in knee pain you can see sometimes people will walk like this. This is a deformity, or walk like this. These both are genuvarum or genuvalgum deformities. For correction of these, we have to do cross squat, cross squat, cross squat, cross squat, cross squat, at least 50 to 70 steps at once. Now, what we have done, cross and steps. To moving in an advanced way, if we will move in an advanced way, we can use a resistance band to tie this, or we can use the weights, to cross squat, cross squat, cross, squat, cross, squat, cross, squat, cross, and squat. No reverse movement, no backward movement, except step 1 for correction of your walking pattern. These were the methods for using your hip strength or to increase your hip joint and pelvic girdle muscle strengthening. There are so many other movements also, but we have designed this movement in an easy way or a step-by-step manner. There are so many other movements for hip movement like this, or in a front way, or in a backward way, or inside way, which we have studied, which we have seen, which we have explained in our last session. Those were the simplest movement of the hip joint to increase the proprioception plus to increase the basic strength of the hip joint. In today's session, which we have seen that to advance movement of the hip joint plus core strengthening with correction of the walking pattern, because correction of the walking pattern is very important. Now, I will request to all of you, if someone is having any gait deviation, then they can make 10 to 15-second video and send on WhatsApp to our group. Then we will see this. We will do a gentle, a basic baseline analysis of the gait pattern. Then we can revert you and we can move towards the correction of the gait exercise pattern in a proper way. So if someone is having gait like this or someone is having gait like this, then don't bother about it. Just make a video of 10 to 15 seconds and send it in group. Then we can design or we can do something special for you to make you more comfortable in basically walking pattern, especially related to your back pain and related to your hip joint pain. As we have discussed, these all things were about hip avascular necrosis, previous session and this session. By acknowledging these sessions, we have seen that the hip strength is related to a SI joint and the low back muscle strengthen. So if someone is having knee joint problem, hip joint problem, SI joint problem, or back problem, first we have to give a basic target on back muscle, core muscle, then we will move in a further way. After moving these, we will see changes in our daily pattern, changes in our sleep cycle, changes in our pattern of movement, so you can do all the movement properly with baseline confidence. So that was for today. Now we will move to our question answer session. I'll see in the chat box. Then